when you're seeing 30 patients a day, you're not providing quality. You're sticking your finger in the small holes in the dike and hoping that no one gets harmed by it.
Mhm. It's
So
100% true.
in my what I call my call to action is
Mhm.
pediatricians may need to make the same as any other physician, which is 350 a year. It's a lot of money,
Mhm.
undeniable. But these
Mhm.
kids are coming out with $300,000 in student debt,
Mhm.
and they missed out 10 years of getting opportunity.
Correct.
And there has to be a
And they
limit.
worked really hard to get there too,
Yes,
Right.
and
right?
and I know I'm being ungrateful, and I don't like being ungrateful. I have such a blessed, lucky life. It's like a rock star life.
Yeah.
Okay. And it's only gets better. I don't know why. I'm just lucky,
Pediatricians are the rock stars of medicine.
but I'm
We
lucky
invented preventive care.
Yes.
Yeah.
to become a pediatrician, a family practice doctor, an endocrinologist, orthopedic surgeon, whatever it is. You give up the best 10 years of your life
Yeah.
between 20 and 30. There is nothing can buy you that back.
And for women who want to have children, many of them then delay it until it's difficult for them to have children.
True.
Either
That is
are
true.
not able
You-
to have their own family or struggle to have a family.
but
Yeah.
the reality is that woman gives up her best reproductive years and opportunity to find a mate. And so she's 30, out of residency, needs to start working, is huge debt, and now has to find a life partner and build a family as she's building a business. This is a tremendous burden on a human being. I
That is
couldn't do it.
correct.
I
But
couldn't do it.
that's correct. But building a
And so,
business is just like any other business. Ice cream store, card shop, video store, it's all working hard.
no, because you don't have to go through 11 years of
Yeah.
education
You don't
to,
start making
You know,
your ice cream shop at 30.
but you
yeah,
have to borrow money to make the ice cream shop.
but
But
Yeah.
you're
you have
correct on
to.
that.
So
So
my
all day
point,
long with physicians, listen, we try to have a good work-life balance. And work-life balance is not just I want to work 4 hours a day, Monday, Wednesday, and Friday. That's not work-life balance. It's other things. Support, culture, access, or people around it, and the computers and whatever you have in the office to make the physician's life better.
so
My wife is a physician also, and she worked in the emergency room. And we did it. We figured it out. We hired a nanny. We got a babysitter. We had my mother-in-law that lived with us, and she didn't kill me. We just did it. I see people that are doubling the physician, the husband's a physician, the wife's a physician, yet they want to work Monday, Wednesday, Friday. We had a doctor that left us because her husband got a job at one of the local hospitals over here as a NICU person. And she promised that she was going to come back to work with us, yet she didn't. She went to the academic center to work because they work Monday through Friday.
Mhm.
And I said, but we have access on Saturday and on Sunday. Sometimes we all rotate. Who do you think comes to our office for her twin baby checks on Saturdays? That physicians.
She does because she's off.
Because she's
But,
off, yes.
but you know what?
But that's the physician that we're not asking work every Saturday of the month.
You know what, though? I would tell you, George, is that I really think as physicians, one of the first things that we have to do is understand our value, right?
Yes,
There's a shortage of us, and it's
yes.
only getting worse. So, one of the things that I tell young physicians is you have spent all of your academic career trying to prove to people that you deserve to do what you're finishing your training doing.
Correct.
You have to change your mindset now. Your mindset has to be I have finished my training, I have enormous value, and I don't just have to go and be an employee in a big hospital system and just be a number or a
Mhm.
cog in the system. I have enormous value and I now have enough training. I can do what I want to do.
Exactly. I love it.
That's what I tell them because I think too many of us start to recognize that 7 to 10 years into practice, like what Herb was saying, right? After 7 to 10 years, they're burned out because they've done more than they were capable emotionally, physically, based on what their demands were, based on what their life goals are. And so then they see it just as I either do it this way or I don't do it at all.